Hello and welcome. This is our weekly live chat, Lunch and Learn. And this week, we're going to talk about risk management. Now, the path to risk management, number one, especially in our health information management and coding department, is to ensure that there is a compliance plan. And we want to make certain, and basically what this is, I mean, it's really simple, right? That we're talking about compliance with the laws, the appropriate laws. And remember that, first of all, not everybody knows what you know. And even if they do, they may not know it to the depth that you know it, okay? So what we need to do is have a plan, a written plan. So everybody, the person the first day on the job, as well as somebody who's been working there 30 years, knows exactly how to comply with the law. Okay. And this is important for that person who's been there for 30 years, because over the course of 30 years, laws change, requirements change, new laws are passed that they may not know about. So it's our job to ensure that there is an effective and an understandable compliance plan. Okay, so the first thing, obviously, that needs to be done is for you to gather together the standards and the procedures. What are each of the laws requiring of you and everyone else? So we'll start with, for example, the False Claims Act. And remember, there's like federal version and state version, but essentially the law requires certain things of coders and billers and other people in our department. So you want to make sure that you make a list of what they are and what the law requires of them. And remember, federal law, state law, a law is a law, which means you have to follow it. If you don't follow it, consequences will happen. And I can tell you, I mean, look how old I am, right? I can tell you that it will catch up with you. It may take an hour, it may take a week, it may take 10 years, but it will catch up with you. So the best way to live your life and lead your career to success and sustaining success is to make sure that you comply with the applicable laws, okay? The next thing you want to do is assign a responsibility to someone. Now, you remember when you were learning about HIPAA, the HIPAA privacy rule requires the designation of a privacy official, someone who is overall in charge. They are the person who is responsible for making sure not only that compliance happens, but the consequences when something falls through the cracks, okay? You remember HIPAA's security rule requires the appointment, the designation of a security officer. And this is not a security officer like the guard who stands in front of the door. This is the HIPAA security rule compliance officer, the person who knows all about the safeguards, the administrative, physical, and technical safeguards, and ensures that the facility continues to comply with all of those components, okay? The third item on creating your compliance plan is to avoid delegation of authority to individuals with an inclination to get involved in illegal actions, okay? Now, this doesn't mean that you're telling on anyone. It doesn't mean that you're a snitch, although I really despise that term. Because when we want to have an ethical and honest healthcare system, you need to be, everybody needs to be ethical and honest. And I'm sorry, I work too hard to let somebody who cheats, somebody who disobeys the law, to interfere with my ability to do my job properly, to get my promotions and my raises, and to make sure that I don't have to go to jail or prison, because I just don't want to do that. Now, you understand that this is not necessarily a big thing, okay? You may have somebody in your department who you know likes to skirt the edges of the rules, okay? All right. You know, as well, leaves 5 minutes early, gets back from lunch 5 minutes late, or thinks that office supplies in the office are free to take home. Those are things that skirt the law, and that tells you, gives you a peek maybe into someone's personal integrity. Okay, so we're not saying you have to go anywhere, do anything. We're just saying don't put them in charge of compliance with a federal law, because they're a person who obviously, or at least obviously to you, does not have respect for law or rules or policies. Okay, all right. Next, effectively communicate standards and procedures to all staff. So this means you need someone to write out in clear language, in this situation, this is what you must do. And if necessary, do not do this. Okay. And yes, once you put a new compliance plan into effect, you want to make sure you have a meeting with your staff so that you can talk about it, so that you can make sure that everybody understands what their responsibility is under the law. You also want to make sure that they understand federal and state legislation must be complied with. And this is not, oh, you're being such a stickler for the rules. Why are you so uptight? Oh, that might be generational. I'm sorry. But you know what I'm saying, right? Is it saddens me being a good girl. All right. Shades of gray. But the point is that in order to have respect for our jobs, in order to have respect for our patients, in order to have, most of all, respect for ourselves, we must have respect for the laws that govern, because bad things happen when you don't. Okay? Now, again, you're not rushing to the teacher to snitch on anybody. This is a meeting to make sure that everybody knows what's right. Right. You've heard people say, oh, you did something wrong. I didn't know that I wasn't supposed to do that. I didn't know that wasn't allowed. Now, that excuse is not viable in court. You cannot stand before a judge and say, oh, I didn't know. Because remember in the False Claims Act, where it says, you know, or should know, right? Okay, so this is where you are going to make sure that everybody in your department and everybody who is applicable for this compliance plan not only reads the words, but understands what their responsibilities are. Okay. And I would include perhaps the consequences for not. Utilize monitoring and auditing systems to detect non-compliant conduct. Now, First of all, anybody who does not believe that their computer is not hooked up to some type of monitoring and auditing system, especially for us working in medical billing and coding, you already know the electronic health records have built-in audit systems. And there is someone who is designated to review that. Make sure that somebody is not looking at somebody's record when they shouldn't be looking at their record. Remember the case of George Clooney, handsome actor, about 10 years, 15 years ago. I forget how long ago it was. He was in New Jersey. He was in a motorcycle accident, taken to the emergency room of the hospital. And while he was in the emergency room, oh, come on, you think that didn't spread through the hospital like wildfire, George Clooney's in the emergency room. Well, 24 members of the staff little did a peeky poo at his electronic health record. And they were all suspended or fired because that is a violation of HIPAA. You're not allowed to look at someone's healthcare record unless you have a business, a job-related reason for looking at that. And just knowing about George Clooney in our ED, no, sorry. So they either got suspended, 24, suspended or fired for a HIPAA violation. So just so that you know, the computers are watching you, and that is not paranoia, that is fact. And that is because the facility as a whole must monitor compliance with every law, whether it's HIPAA, the Federal False Claims Act, Stark, anti-kickback law, it doesn't matter. So it's not like they're going to have cameras in everybody's office, because that doesn't tell you really much, okay? It's inside the computer. All right, but there has to be a process, and there has to be somebody who is following up on those audits daily, at the very least weekly, because at some point, if you don't, the federal government or the state government will. And trust me when I tell you, you don't want the Office of the Inspector General, the OIG, knocking at your door. Okay. Enforce adequate disciplinary sanctions when appropriate. So what that means is you need to have consequences for actions that are contradictory to the health and well-being of the facility and every single person within, whether employee, volunteer, or patient. Period, finished. Now, come on, you want to work in healthcare, you need to be a positive force in healthcare, because that's where the success lies. Promotions, raises, things like that. But you know what else is? It builds your integrity. And that's got to be the number one thing you have for your own self. The littlest infraction, you must put consequences, okay? And you know, it's not, oh, you forgot to put a period at the end of that sentence, off with your head. It's not that. But when you start, even in a small instance, when you start by sitting them down in your office and having a conversation and saying, we know you did this. This is your warning. Don't do it again. That's that old saying, a word to the wise is sufficient. Sometimes just letting people know that you know, so they know that you know, which means soon the government is going to know, soon the health officials are going to know, and they're not getting away with anything. 90% of the time, that's going to be sufficient for this individual to back up and be certain to dot their I's and cross their T's. Sometimes that's all it takes is a little conversation. But this is important, and this is important to everyone. Okay, I have seen private practices go out of business because of fines, penalties, and sanctions for failure to comply with the law. This is serious. You got to take it seriously. You are working with people's lives. And, you could sit there and say, but I'm just a coder. Yes, well, we've already discussed this. You're just a coder with their hand on the revenue stream for the entire facility and on behalf of the patient. And if you don't code it correctly when you submit that claim, the claim may be denied. And if your facility or your doctor's office does not follow up on that and correct it, and instead just sends the invoice to the patient, that could put that patient in jeopardy. That could put that patient not having a procedure that they need because they can't afford it. That may put that patient in bankruptcy. That may get that patient thrown out of their house, fired from their job, on the street, because you didn't get that code correctly. And am I being dramatic? A little bit. But the facts are the facts. Okay? Remember, your patients don't know what to do. They trust you and your facility. You send them an invoice and says insurance wouldn't pay. 9 out of 10 times, the patient's going to pay if they have the money. Not fair. You don't like that when it's done to you. Remember, what goes around comes around. And no matter what, we all become patients at some point. So let's start our careers with respect for the patient, respect for the facility, and respect for ourselves. Following the law is respect for yourself. It is. Okay. This is starting to sound like a lecture, so I'm going to show you this. This is a link that you can go to, and it is healthcare compliance program tips. Now, you may say, well, I'm just getting ready to finish school, and I'm not going to be a manager that quickly. Well, first of all, you don't know that. But second of all, this is good information for you to have. So when you are in meetings with your managers, when you are at that interview, and you can discuss compliance like the well-educated, up-and-coming professional that you are, that puts you at the top of the pile. All right. This week, you're going to read chapter 6, defenses for liability suits. Now, you'll notice that this chapter is about medical malpractice, more from the clinical side. But I really think there's still a lot that you can get out of it, that you can apply to the administrative side of the facility. And at the very least, this is something that you should understand. Okay? All right. After the chapter review, you're going to do your assignment, and then you're going to do your homework, and then you're going to do your quiz. And I put additional stuff, compliance guidance, in the course room for you to review. Again, this is really higher level information for you, and to fill in the gaps for the parts of the chapter that you may feel don't apply to you as an up-and-coming medical coding professional. Okay? And remember, I am here for you. I am at the other end of an email. Well, not physically and, not immediately, but within 24 hours, I promise you, I will respond. And then we can email back and forth. We can set an appointment to speak on the phone. We can Zoom, we can FaceTime, we can WhatsApp, whatever. Okay, I put Skype there. I don't know if anybody uses Skype anymore. Regardless, I can Skype if you want. The point is, I'm here to help you. I'm here to help you succeed.